Welcome to an interview with Jocelyn Cornwell, who's Director of the Point of Care program in the King's Fund in England. I'm hoping that you'll enjoy listening to some of Jocelyn's answers about her experience and the work that she does in patient care experience.
It's very exciting to be starting something and looking forward to it growing in the way that I've watched patient safety grow. I also think that we, like other people, are beginning to get the fact that experience, safety and quality are all interconnected. And so we have the potential, I think, to bring all of these things together now in a new way, practically. This is an agenda that really seems to grab people who work in healthcare. Ever since we started, we've had people writing to us, accessing our website, coming to meetings, saying these are the issues they really want to talk about. So that's very exciting. It's like pushing at an open door. I think the fact that this feels like the start of something internationally as well is very exciting. I see the work around patients' experience as being about 10 years behind the work on patient safety. So I think we're at the beginnings of where patient safety was in around 2000. Patient surveys in the US have had a very dynamic effect. And have catalysed organisations into taking an interest. Paradoxically, we'd had patient surveys in England for much longer, and they hadn't provoked that kind of attention. So they don't provoke attention just in and of themselves. It depends on the context, I think. I think it's campaigners, patient activists, it's concerns about poor quality in some cases in England, but it's also, I think, the slogan which is nothing about me without me, which you begin to see internationally and which has traction in the UK as well, is one that seems to have grabbed the politicians and makes sense to them. And so I think it's a combination of all sorts of things actually that have brought it to this place. I think people are beginning to understand that what we need is a rounded definition of quality of healthcare, which has all three legs of the stool. But there's a big gap between policy and implementation, and the world of practitioners is being very seriously shaken, I think, by the need to cut back very significantly on budgets. And my fear is that that will distract senior people from the quality agenda, and also that the kinds of solutions that people find to financial problems will be detrimental to patients and to their experience. That it won't be about cutting out waste, it will be about cuts that will affect staffing and therefore affect quality. So I think that's a very big threat. In more ordinary terms, I think that getting doctors on board with this agenda is a really important thing to do. And I would really like to see strong medical leadership in this area alongside nurses and other colleagues who I think do get it. The King's Fund's a charitable foundation in London whose mission is to improve the quality of health and healthcare in England. And the Point of Care program, which has been running for 4 years now, is primarily a healthcare improvement program. So where we do research, mainly synthesizing research evidence and sharing it with the service, and then we test out practical interventions with hospitals in England. The origins of the programme came from, in fact, me listening to two stories from people I know very well, who are both healthcare professionals, talking about their mother's experience in hospital, which was less than ideal. I came to this work, though, with a background as an academic researcher. I'm a social scientist. I'd worked as a manager in the National Health Service, and I had worked in regulation for many, many years. So I've always been interested in the experience of patients, and this was a new opportunity really to do a different kind of activity. I think the King's Fund as a place from which to publish, if you like, it has an authority of its own and an independence. So producing a serious report about patients' experience from the fund has been, I think, a very serious contribution in the UK. And alongside that, raising the importance of staff experience and bringing the Schwartz rounds to the UK, I see those as really valuable achievements. The Schwartz rounds are a mechanism for helping staff to reflect together on their experiences as caregivers. And they come from the Schwartz Centre in Boston, which is committed to strengthening the relationship between caregivers and patients. And so they're a practical way of helping staff to think about the issues that providing care raises for them as individuals and with their colleagues. The evaluation of rounds shows that they bring benefit to those who attend, and also that they help to influence the wider culture of the organisations in which they occur for the better. I think understanding the complexity of health care and healthcare organisations from an outsider's position, an informed outsider, is a really valuable thing to do for this kind of work. It means that the programme is not uniprofessional. I see it very much as on the threshold of all kinds of things and able to translate, if you like, between professions and managers and policy makers, and patients and clinicians. What I would like to see and what I expect to see in the next 10 years is a really serious weight of research, development of practical tools, development of practical training in the way that we've seen in patient safety. Taking it out of the realms of rhetoric and making it for real. I think that there's an enormous agenda around patient engagement in both in people's involvement in their own care, but also the involvement in governance of organisations, in decision making inside healthcare. And I would like to see services run in a much more democratic way, so that the people who are using services get an equal place at the table alongside the health professionals and the managers, so that they can influence the way in which decisions are being taken in terms of both delivery of services and planning of services.
I hope you've enjoyed this interview with Jocelyn Cornwell, an expert in the area of patient care experience, and sharing her thoughts about where things are going in the future. We hope that you'll join us for another spotlight on an expert in the future.